My name is Amrit Dillon. I am doing my presentation on Harrods, the department store. It's located in London in the United Kingdom. The employee health and promotion program that I'm hoping to implement is a diet, fitness, and stress intervention program. Harrods is the biggest department store in Europe, and it houses 330 departments that offer a wide range of products and services. Products on offer include clothing for women, men, children, electronics, jewelry, sporting gear, pets and pet accessories, toys, food and drink, health and beauty items, packaged gifts, stationery, housewares, home appliances, furniture, and much more. Up to 300,000 customers visit the shop on peak days, comprising the highest proportion of customers from non-English speaking countries of any department store in London. More than 5,000 staff from over 50 countries work at Harrods. The United Kingdom of Great Britain and Northern Ireland consists of England, Northern Ireland, Scotland, and Wales. People in the United Kingdom are living longer. Women continue to have a higher life expectancy than men, 80.5 years and 75.8 years respectively. By 2030, about 1 in 5 people in the United Kingdom will be aged 65 or over. British people can expect to have more years of unhealthy life than people in most other European countries. The UK healthcare system, National Health Service, came into existence in the aftermath of the Second World War and became operational on July 5, 1948. Despite numerous political and organizational changes, the NHS remains to date a service available universally that cares for people on the basis of need and not ability to pay, and which is funded by taxes and national insurance contributions. Healthcare and health policy for England is the responsibility of the central government, whereas in Scotland, Wales, and Northern Ireland it is the responsibility of the respective devolved governments. In each of the UK countries, the NHS has its own distinct structure and organization, but overall, and not dissimilarly to other health systems, healthcare comprises of two broad sections. One dealing with strategy, policy, and management, and the other with the actual medical clinical care. Increasingly, distinctions between the two broad sections are becoming less clear. Circulatory disease, such as heart disease and stroke, cancer, especially lung cancer, and respiratory diseases are the most common causes of death in the UK. However, these health problems are on the decline. Health problems that are on the rise include obesity, diabetes, hypertension and high cholesterol, inactivity, poor nutrition, smoking, and mental health. The concept of free healthcare at the point of access has become ingrained within the belief systems of the majority of the UK population. Generally speaking, people are disinclined to pay directly for healthcare services. Therefore, it is likely that any sustainable measures that are implemented to promote health and decrease the burden of disease within society will have to be at least partially sponsored by the central government. Although there have been improvements in life expectancy within the UK population, there are still some stark variations. In certain areas and among certain groups, often ethnic minorities, life expectancy can be up to 10 years less. Many workers experience long working hours, long commutes to urban centers of commerce, and a high cost of living. Couple these factors with increasing consumerism and an increasingly secular and fragmented society, and it is not altogether surprising to see why lifestyle choices are becoming compromised. As of 2010, the new owners of Harrods are the Qatar Holdings Group. The new owners are strongly committed to all of Harrods' employees. They recognize the employees are essential to the continuing success of the business. Such employees are likely to be happy and consistently high performers who want to progress their careers with Harrods. The Harrods Human Resources Department has already adopted new methods to increase employee engagement. This has positively changed the organization's culture to establish the business to meet the needs of its employees whilst also maintaining the company's values. The Harrods motto is "All things for all people, everywhere." Our goal in our health improvement strategies is health for all people, starting with Harrods. When communicating with the Human Resources Department, we hope to prove that workplace health promotion should be seen as a strategic function of an organization. It helps to build a competitive edge for a company by positively engaging its employees. Engaged employees are more likely to be proud to work for their company, and therefore will believe in and live out the values of the organization. The benefits of a health promotion program for the organization include a well-managed health and safety program, a positive and caring image, improved staff morale, reduced staff turnover, reduced absenteeism, and increased productivity. Benefits for the employee include a safe and healthy work environment, enhanced self-esteem, reduced stress, improved morale, increased job satisfaction, increased skills for health protection, improved health, and improved sense of well-being. Risk factors for employees in the UK include obesity due to lack of proper nutrition and inactivity, as well as mental health issues due to increased stress. These factors are a result of the current lifestyles that most UK citizens have adopted: fast-paced with long commutes and no time to cook or exercise or take care of themselves. 60% of men and 72% of women fail to meet the recommended levels of physical activity. Only 13% of men and 15% of women meet the recommended fruit and vegetable intake per day. Stress is the main cause of absenteeism. Our goal is to provide a comprehensive wellness program that can improve one's susceptibility to the health risk factors. Survey questions include: how often do you engage in moderate physical activity per week? How would you rate your current diet? How often do you experience work-related stress? And do you feel the company addresses these areas of your health and well-being? The health promotion program that I am suggesting is a mind and body wellness program. Physical, mental, spiritual, and emotional wellness are the key components to maintaining a balanced life and overall well-being. Regular exercise, healthy nutrition, and stress coping mechanisms are the first steps in achieving a healthy body and sound mind. This program will have a three-pronged approach. The first approach is health assessment and wellness screenings. We will start with a survey to determine one's current state of health. This is a subjective survey based on their personal assessment. We will also start with checkups from doctors. The second approach is an online wellness education. This will include proper nutrition classes, stress coping mechanism classes, and fitness education classes. The third approach is on-site workplace programs, such as lunchtime fitness sessions and support groups. These comprehensive approaches will help to enhance health and wellness in both the mind and the body. In order to evaluate the success of these techniques, we will use quarterly checkups with doctors, as well as allowing employees to set their own goals and reflect upon them in quarterly reports. We expect the health improvements among employees to include increased physical fitness, better nutrition, reduced stress, and increased mental health. In order to measure the feedback from employees, we will engage in telephone screenings and surveys. The company already conducts surveys, so this will not be too much of a stretch for the employees to also conduct a survey based on their health and wellness. Telephone screenings are new to the UK but would still be a great asset to the evaluation of the programs. Based on these evaluation techniques, we will gather statistical data and analyze it based on increased employee morale and overall employee health. We will then send this report to the Human Resources Department. Since 2010, the Qatar Holdings Group has shown that they are determined to take care of their employees. A workplace health prevention program is just the next natural step for Harrods. Benefits of continuing this program include increased employee morale, increased productivity, increased sense of community amongst the employees, increased job satisfaction, decrease in employee turnover, all while upholding the values of the company. Future recommendations include an in-house gymnasium, or at least a stipend for health and wellness programs off-site, health and wellness competitions, and increased communication amongst the different levels of leadership about the concerns of the employees in regards to their health and wellness. This is already happening in regards to their overall happiness at their job thanks to the human resources changes since 2010.